Hello, my name is Denise Worley, and I am the Commissioner for the West Virginia Bureau of Senior Services. I would like to welcome you to the road ahead, and this afternoon we have a very special guest with us. Her name is Rebecca Gowdy, and Rebecca is the State Health Insurance Assistance Program Director and works at the West Virginia Bureau of Senior Services. Welcome, Rebecca.
Thank you for having me.
We're glad to have you this afternoon. So, Rebecca, can you start off maybe by telling us a little bit more about yourself and what brought you to the position that you're in today?
Yes. So I am a licensed social worker, and I got my bachelor's of social work at the Concord University. I'm a lifelong West Virginian here in the Kanawha Valley. And I started with these programs straight out of college, doing my internship with the Aging and Disability Resource Center that helps people navigate long-term services and supports. And one way they do that is to help people navigate through their Medicare. So I started there and then just moved my way up into the director position. I really have a passion for helping people with their Medicare.
Okay, all right. So can you tell us a little bit more about the programs that you oversee at the Bureau of Senior Services?
Yes. So we have 3 federally funded Medicare programs through the Bureau of Senior Services. We have our SHIP program, which is the State Health Insurance Assistance Program, and that is meant to help Medicare beneficiaries, their families and caregivers navigate through Medicare so they can make informed decisions. So we're an objective resource available to help people with their Medicare options so they can make those decisions. We also have our Senior Medicare Patrol program that focuses on Medicare fraud and abuse, helping to protect people's Medicare. And then we have our MIPA program, which focuses on low-income Medicare beneficiaries and helping them get assistance with their Medicare costs.
Okay. Well, it definitely sounds like there's a lot of supportive services that you're able to provide to our seniors across our state. You had first mentioned the SHIP program. So could you remind us again what the acronym SHIP stands for, and then maybe just tell us in some more detail some of the specifics surrounding SHIP?
Yes. So SHIP, again, is the State Health Insurance Assistance Program, and it focuses on Medicare beneficiaries. And Medicare can be very complex. There's a lot of different components to it, rules about when to sign up, how it works with other insurance that you might have. So it can definitely be a little daunting when it's time for you to look at Medicare. And so we're here as a resource to help you navigate that. We are objective, free, unbiased, just a resource available to help people navigate through their Medicare. And with the SHIP program, we have counselors around the state at our county senior centers and our Aging and Disability Resource Centers, as well as the Bureau of Senior Services to help our Medicare beneficiaries in West Virginia.
Very good. A few things that you mentioned that stood out to me is the fact that the service is free. And that is something that I know that is very good for those people working with Medicare to know that there's a resource that they could take advantage of, that there's not a cost associated with it. And then you also mentioned that there are offices that are located throughout our state. So no matter what part of our state you live in, you would be able to connect with a resource counselor that's in your area that could support you.
Yes, so we do have counselors around the state. There might not be one in every county, but there's definitely one in a neighboring county. And you can also call us, so we can do it by phone as well. And we do have a toll-free number that is available for people to call, and that number is actually published on Medicare literature as well. So your Medicare and You handbook, if you have that, you can flip it over to the back cover and find our phone number. So our information is definitely out there as well, that you can give us a call or you can come in to see somebody at a local senior center.
Okay, and that's nice that there is both options, because oftentimes it's difficult for some of the seniors to get out and about. So to be able to make that call from the comfort of your home, or if they have a person that supports them and helps them with their activities of daily living, that person to be able to be with them and help them and make that phone call would definitely be a very good thing. Something that I would think might be a common question that people may want to know is, can I just enroll into my Medicare programs at any time? Can you tell me a little bit more about, are there timelines for that and parameters around when you can enroll and what you can enroll in?
Yes. So as I mentioned before, Medicare is complex and complicated sometimes, so that's a little bit different than some other insurances where you can enroll at different times. So with Medicare, you only have certain windows, and so it's really important that you know what those windows are so that you're not being left without health insurance. So there's a window when you turn 65 that you can sign up for Medicare, or if you're receiving Social Security disability, you can sign up for Medicare. But then there's also other times during the year, depending on if you moved outside of a service area, if you lost insurance. So some people work longer than age 65, and they keep their employer coverage, and now they're getting ready to retire. They're going to have some enrollment opportunities. So it's just important that people know, though, that there are only certain windows, and they don't want to miss that opportunity. So again, that's what we can help with through the SHIP program, is to help you know when those windows are for you and to make sure that you don't miss that and don't potentially face a penalty if you don't sign up when you're first eligible.
Yes. So it does sound like there are some complexities, as you mentioned, but having yourself and overseeing these programs and the counseling that is available to people seems like it definitely would break down some of those barriers and some of those complexities for people and be able to set them up to enroll in a program that works very well for them. You had mentioned something about following that certain path so you didn't run into any type of penalties. And I guess that word penalties, just, it sounds like a little bit of a scary word for people to maybe worry a little bit about if they don't follow that program or that path in the proper way or the proper order. So can you help maybe ease some of those concerns about penalties? Maybe tell us about what those penalties are, or how those work, and how people can navigate that?
Yeah, and I think that's one of the great things about the SHIP program being local here in West Virginia. Although there is a SHIP program in every state and 4 territories, so if you have friends and family in another state, they also have access to the SHIP program in their state. But we are local here in West Virginia. We also understand a lot of the insurance options that are available in terms of what you could have with Medicare. So West Virginia Medicaid, also the Public Employees Insurance Agency, PEIA coverage, and how that works with Medicare. So I think that's really helpful that we have that information to be able to help people make those decisions so they don't potentially face penalties. But with the penalties, if you don't sign up in your particular enrollment windows, you could face a penalty. So that's why we want you to reach out. It is case-by-case scenarios of when your window is and what penalty you might face if you don't have other insurance. So it depends on what other insurance you might have too. So there's a lot of, like I said, complexities to it, so it just depends on the individual. But again, they could reach out to us and we can help walk them through that to make sure that they're not going to face a penalty.
Okay. And what would be an example of a penalty when you reference a penalty? Can you expand on that just a little further?
Yes, so there's 2 main penalties that can come into play. So one is if you don't sign up for the medical insurance with Medicare, which is called Part B. And so some people don't sign up for that. If you don't have active employer health insurance, you could face a penalty, meaning that you pay a larger premium for your Part B than the base premium. And then the other is related to prescription drug coverage. So if you don't get prescription drug coverage through Medicare and you don't have credible drug insurance through another source, then you could face a penalty with your drug coverage, and that also means that you would pay a larger premium.
Okay, okay. And you mentioned Medicare Part A and Medicare Part B, and I was thinking this might be just a good time. Can you give us just a general overview of what Part A and Part B is?
So Medicare Part A is hospital insurance. It's your inpatient hospital coverage. It also includes skilled nursing facility care and hospice care. And for most people, Part A is premium free because that's what you work and pay your Medicare taxes to. If you did not work and pay into it, you might be able to draw off of another person who worked and paid into it, like a stay-at-home spouse may be able to draw off their other spouse who worked and paid into it. And then Medicare Part B is your medical insurance. It's what I call your everyday usage of your Medicare because that's your doctor services, outpatient services, emergency room, lab work, durable medical equipment, and preventive services. Part B does have a monthly cost to it, and that just depends on your income, what that premium is going to be, and it changes every year.
Okay, okay. And you had mentioned some of the services or some of the things that the Medicare Part A and Part B covered. And I think it just with the time of year that we're in, with being in the winter months and being in that cold and flu type season right now, are there some of those preventative services, like, for example, flu shots and different vaccinations and things that are available to keep people healthy and well? Are those types of things that are covered for our seniors when they have their Medicare?
Yes. So Medicare does cover preventive services, and preventive services are usually available at little or no cost to the Medicare beneficiaries, and that can and does include your flu shot. It also includes the COVID vaccine, a pneumococcal shot. But it also includes screening mammograms and colonoscopies, diabetes prevention classes, tobacco cessation classes. So there's a lot of different Medicare preventive services available to beneficiaries.
It sounds like there really is just a wealth of things that are covered, and probably some of these that people may not have even thought about. You'd mentioned smoking cessation, some of the diabetes education, and those are all very important things in our state. So, yes. All right. Well, we've talked a lot about the SHIP, the State Health Insurance Assistance Program, and I know that there's other programs that you oversee at the Bureau as well. So I thought we could take just a short break, and then when we come back, we'll have Rebecca talk with us more about the other programs that she oversees and the other services that are available to our seniors throughout our state.
Bring it. Time out, guys. I'm late to dinner. My mom's gonna kill me. Catch you guys later.
Mom wants us home.
Okay. Bye, guys.
You guys need a ride?
Sure. Yeah. All right. How about some one-on-one? I gotta go eat, man. Sorry. I'll see you later.
Hello, and welcome back to The Road Ahead. Again, I am Denise Worley, the Commissioner for the West Virginia Bureau of Senior Services, and here with us this afternoon we have Rebecca Gowdy, and Rebecca is the State Health Insurance Assistance Program Director. And before we went to break, Rebecca had shared a lot with us about the Medicare programs that are available and the support services that are available to the seniors throughout our state. And in our second half, we want to talk with Rebecca a little bit more about some of the other services that are available. And one thing that I thought maybe we could kind of start out with is I know that recently there was an inflation Reduction Act that was signed into law, and that had an impact on Medicare and the way that services and programs were delivered. So could you kind of start us out and talk a little bit more about that?
Yes, so we were talking before the break about preventive services and some things that are available. Well, the Inflation Reduction Act has also brought into law some changes with Medicare that's to help reduce cost for Medicare beneficiaries. One of those is vaccines. So commercially available vaccines, outside of the ones that I mentioned before, are available through Medicare Part D prescription drug coverage, and now they are available at no cost. So you don't pay a copay or deductible towards those vaccines. So you can get any of those that you might need, like the shingles, RSV, whooping cough vaccines at no cost. It also made insulin be capped at $35 per month supply. So you're not going to pay more than $35 a month for your insulin, as long as it's covered by your insurance plan. And then this year, it implemented the extra help expansion, meaning that low-income individuals under 150% of the federal poverty level all pay the same copay maximum. So before, there were some people who paid a little bit higher for their prescription costs, and now that's been reduced. And then also with prescription drug coverage, there's different phases that you go through. And so the very last phase is what's called catastrophic coverage. And it used to be that you paid 5% of the cost of your medicine in catastrophic coverage, and now that is 0. So everything in the Inflation Reduction Act related to Medicare is really meant to help reduce costs to Medicare beneficiaries.
And that is very good for people to know. And I know we mentioned earlier about how complex Medicare can be, but when seniors are able to connect with someone like yourself or some of the other counselors, and you all break that down for them, it really seems quite simple, so that there are so many services that are available for them at very little to no cost. So just, I think, helping people to understand what those programs are is definitely breaking down the complexity of the program. Now, there is a term that I've heard, something called Medicaid unwinding, but I'm not clear on what that really means and how that applies to Medicaid recipients. Can you tell us a little bit more about Medicaid unwinding?
Yes. So it has to go back to the pandemic. And during the pandemic, there were policies in place that Medicaid could not be closed for anyone, even if they were no longer eligible. Well, now that the pandemic has ended, that policy has ended. And so over the year, starting April of last year through April of this year, there's the Medicaid unwinding. And so everybody has to go through the process of being re-evaluated for their Medicaid and determining whether or not they're still eligible or not. And so there's a lot of Medicare beneficiaries who also have Medicaid, but some of them are no longer eligible for Medicaid for different reasons, different rules. And so that is something through the SHIP and MIPA programs that we're able to help those Medicare beneficiaries understand why they might not be eligible, or maybe they are still eligible, but there was an error, or maybe they didn't turn in certain documentation that they need to turn in. So we're also able to help them through that process as well.
Which is really just another one of those examples of taking such a complex program that's so vast and really breaking it down and making it individualized and person-centered for each person that you're attempting to help. And it sounds like it could be a process, and services may be different, but there are still services and programs for people that will be very tailored to their specific needs. So I know that we've talked a lot about some of the programs that are free or at maybe little cost, little to no cost. But can you tell me a little bit more about maybe some programs that are available if people do have an issue with needing some support with some of the costs associated with Medicare?
Yes. So there's a couple programs available to help with your Medicare costs. So I mentioned before that there is a premium to Medicare Part B, and that varies based on your income, but that can definitely be pretty expensive for some people. So depending on your income, you might be eligible for a program to help pay that premium for you, and that is something that we're able to screen you for to see if you might be eligible and also help you apply. That determination is made by the Medicaid office, but we can help you go through that application process to see if you might be eligible for that assistance. And then another program that's available is called the Extra Help Program, which is a Social Security-based program to help with prescription costs. So as I mentioned, there's different phases that you go through with drug coverage, deductible, the coverage gap or donut hole. And so the Extra Help Program helps to reduce those costs so that you pay very minimal co-pays for your prescriptions depending on your income. And so we can also screen you for that and see if you might be eligible. That program actually goes off of household size. And so oftentimes grandparents who are raising their grandchildren might be eligible because they have a larger household size. So definitely it's worthwhile checking out to see if you might be eligible for it.
Yes, so there's definitely support there that reaches far beyond maybe what someone would typically be thinking about. So. And I know that we've talked so much about all of the good programs and all of the good services and supports that are out there. So you guys are definitely the good guys in that process. But I'm going to transition our talk a little bit on a different side of maybe like the bad guys of the program, because there are people, there are businesses, entities, organizations out there that just are bad actors and bad guys that sometimes can create some fraudulent schemes or situations that seniors can be at risk and potentially be harmed from. So I know in addition to all of those good programs that you all provide, you also can provide a lot of support to protect people from the bad guys. So could we transition our talk a little bit more about some of the Medicare fraud and some of the things that people can do to prepare, to be aware, to prevent things like that?
So through our Senior Medicare Patrol program, we provide fraud prevention and awareness to help educate Medicare beneficiaries and their family and caregivers about ways to protect their Medicare information. The biggest most important way that you can do that is to protect that Medicare number. So everybody on Medicare gets a Medicare card that has their number on it, and it's unique to them. You should treat it just like you would your Social Security number or your credit card number. Do not give that out to unsolicited callers. The biggest thing I can see there is that Medicare will never call you. So anytime you get a phone call that says they're with Medicare, no, they're not. And it's okay to hang up the phone on those callers. Also, Medicare does not send out new cards every year, and that's a little bit different than what we're used to with a lot of other things related to insurance that you think you should get a new card, but you don't. So if you get a phone call saying, "Did you get your new card for 2024?" hang up the phone, do not give out your Medicare number. Another way to watch out for Medicare fraud and abuse is to look at your Medicare summary notices. And those are statements that you get on a quarterly basis that tells you the services that you've had over the last 3 months. And we recommend that people just look at that and make sure those were services that you received. We've had some recent scams where people have been looking at their Medicare summary notices and they see catheters on their summary notice. They don't need those, didn't receive any in the mail, but they see charges on their Medicare statement. And so those need to get reported. And so that's why it's important to look at those and just make sure there's nothing showing that you didn't receive.
Well, I definitely think that's a very important service to provide to the seniors, that to know, give them those pointers on how to protect themselves from things like this. And you had mentioned that if you feel like you have been the victim or were potentially a victim of something of this nature, you could report that. Can you tell us who would you report that to?
Yeah, so you can actually report that to us, the Senior Medicare Patrol, and then we would report that on. So like if you did have a case where you saw a fraudulent charge on your Medicare summary notice, we would help to get that documentation and report that to the Office of Inspector General, who investigates Medicare fraud. If you happen to have compromised your Medicare number or feel like you did, we can tell you what steps to go about to do that. You can call 1-800-MEDICARE and report your number as compromised, and you can request a new number if you feel like your number has been compromised. And Medicare will sometimes replace your number if your number's been compromised as part of a data breach, but again, they're just going to send you that notification by mail. They're not going to call you and tell you that.
Okay, that's very good. Well, as we wrap up our time together, I do think you've shared a lot of very valuable information that I feel would be very helpful to seniors or caregivers, people who are supporting seniors. So you've provided us with a lot of really good information to be able to help them. If we were to pick maybe just a few takeaway points of highlighting, can you just share with the viewers what you think a few of those important takeaways might be?
Yeah, so I think one is to know you're not alone in this process. It can be very daunting looking at all of the Medicare options, trying to figure out when you need to do what you need to do. You're not alone. We are here. We're local. We're in West Virginia. We can help you. So we're happy to have you seek us out for assistance. Also to know that there are programs available to help with your Medicare costs if you feel like you're struggling with those expenses. And then also that Medicare will never call you. I think that's the biggest takeaway there, is to know that Medicare is not going to call you and nobody should be calling asking for your number.
Okay, great. Well, Rebecca, thank you very much for your time with us today. And I think that you've again provided some very valuable information to the people who are viewing. So since we are both at the Bureau of Senior Services together, we will just continue to work together and to help support our seniors with the programs that they need and the services that can benefit them, and we'll continue to serve the seniors of our state. So thank you very much for being here with us. And thank you to the viewers that have joined us for our informational session this afternoon, and we look forward to meeting with you again the next time. Thank you.